Hi, everybody. Like Inger, I started Chi Nei Tsang, or I first was introduced to Chi Nei Tsang back in the year 2000, which was my first visit to Dao Gardens. I must confess, if I'm absolutely honest, when I first heard about Chi Nei Tsang, I thought, sounds a bit strange. Rubbing bellies, rubbing abdomens, and this actually cures everything. So I probably started out feeling slightly skeptical about Chi Nei Tsang while being very committed to all of the other practices. Then I had my first Chi Nei Tsang session myself. And in that first Chi Nei Tsang session, not only did a lot of emotion start coming out, but a lot of memories started coming out that I didn't even remember had happened. So that sparked my interest, and I thought there's something extremely powerful in this practice, and there's something that I need to learn here. So I was immediately moved from being pretty skeptical to being a convert. Now that's always dangerous, because converts sometimes go too much to the other extreme. Anyway, I started studying Chi Nei Tsang 4 years ago, and have been very grateful for the teachings that I've had. In the last 2 years, I made a decision that I wanted to not only use Chi Nei Tsang in London or America, working with the kind of people who were interested in alternative medicine and alternative therapies. I decided that I wanted to use Chi Nei Tsang in countries where people don't have access to medical care in the way that we have in the West. So I moved out for some time to the Eastern Mediterranean area, and I decided that I would focus primarily on working with women and children, mainly because in that part of the world there is usually quite adequate care provided for men, but women often are functioning in a fairly repressed situation socially and economically, and children are not given a great deal of attention until they become older. And I'd like to share 4 cases with you, 2 of them children and 2 of them women. And the first case I'm choosing is, I think, very significant in demonstrating the power of Chi Nei Tsang. I was really surprised one day when a woman that I'd been working on came along with her 9-month-old baby. And I thought she was coming for herself and that someone was going to babysit the baby, but discovered that in fact she was coming for treatment for the baby. Now the little boy had been born with a kidney problem, which meant that his urine only came out partially, and a lot of the urine was withheld in the body, and this was causing toxicity in the kidneys. He had been having kidney tests approximately every 2 to 3 weeks, and the tests had been getting progressively worse, and there was quite considerable concern about the health of this baby. Anyway, when I saw that I had a 9-month-old baby, I thought, okay, we need to really do some rethinking here about how to use the techniques. And I didn't have a lot of time, so I think, like my colleague here, I sent it out. I asked for guidance, I asked for help, I settled myself by smiling into my organs, asked for guidance, and to be shown exactly what was needed to do with this baby. So I also thought about how do I apply the techniques of Chi Nei Tsang? Clearly with a baby you can't go pressing into their abdomen, and also how do you keep the baby engaged in the session? And so I thought I have to both make this playful and yet meaningful, and at the same time teach the mother and the grandmother who was also there, because this baby will need the help in between sessions. So I did 2 things. I used my little finger, and I also used a little wooden, it was actually almost like a little toy that the mother had brought with her, but it had a rounded wooden end on it. Very smooth, very soft. And I started just by stroking, firstly, just by laying my finger on the navel. You can't really work around a 9-month-old baby's navel, just laying my finger in the navel. I went on to do a detoxification using these various techniques. The baby came back about 3 days later, and I did a follow-up treatment again, detoxifying as much as I possibly could, and demonstrating the various kidney points that could be worked on to the mother. The baby was due another blood test on the Friday, and I saw them for the second treatment on the Wednesday. The mother came back on the Monday with the baby, absolutely delighted, because the blood test had come out negative. Now, to this day, I can hardly explain and hardly understand the power of that. But I thought, you know, sometimes as adults, we can psychologically condition ourselves to thinking we're better because we've enjoyed a treatment. But a 9-month-old baby, firstly, can't tell you anything, and secondly, his psychology is not going to affect the outcome. But there was a medical test which proved that something had changed. And I continued to see the baby. I gave him another 3 treatments in quick succession, and I continued to see the baby about every 2 to 3 months for follow-up sessions. And to this day, the kidney tests are negative. And the doctors in the hospital there have asked me if I will show them the techniques for that particular syndrome, because there are other children who are suffering from the same thing. And again, I think if I had any remaining skepticism whatsoever, that completely, totally convinced me of the immense power of this work. So that was that little baby. The other child I'm treating a number of children, but the other child I'd like to tell you about was a 13-year-old boy who again seemed almost impossible to treat. He was born with brain damage. The cord was around his neck. He had oxygen deficiency. He was almost completely deaf. I'm afraid nothing has changed in the deafness side of things. Almost completely deaf, very poor eyesight. But the thing that was very striking was that he had his diaphragm, when he was born, was not attached. And so they opened him up right down, so split right through the center line. They opened him up and they sewed his diaphragm to the bottom rib. The child also had ADHD, hyperactivity attention deficit disorder. He had that, and so it was a very, very challenging case. And within the first 5 minutes, while his mother was still trying to explain to me what was wrong with this child, the child had managed to find all the padlocks in the room, close them all. They didn't have keys. He'd managed to damage something in the room because he had hyperactivity problems, and he also had some mental problems because of the oxygen deficiency at birth. Anyway, it was clearly very important to work on this diaphragm that had been sewn to the ribs. And obviously it was affecting his breathing very badly, and he had sinus problems. He had all the typical lung syndrome problems.